Is imagined ugliness more common in men or female? Well, the answer is it's approximately the same. And most data show that the distribution is the same, about 50%. But some data shows that the ratio of female to male is about 3 to 2. So the question is, what is imagined ugliness or imagined defect? Imagined ugliness, which doctors call body dysmorphic disorder, is a condition where a person is preoccupied with a body part or body parts that they perceive to be ugly or defective, and they spend a great deal of time trying to fix this defect. And in reality, there's no defect, or there might be just minute defect, but the reaction to this defect is out of proportion, and it causes significant stress and dysfunction in their life. So what causes imagined ugliness or imagined defect? There's actually no known cause of imagined ugliness or body dysmorphic disorder, but there are some theories that it could be due to chemical imbalance in the brain. This theory comes as a result of the condition responding to certain medications. This condition has family linkage. If one person has this condition, the first-degree relatives are 4 times more to get this condition compared to the general population. The people with imagined ugliness, most of them don't have insight. Some have insight that this problem, actually they're thinking that is ugly, this defect it's not there. But others are convinced that this thing is there. And so what are the features of body dysmorphic disorder? So one of the features is that the person becomes preoccupied that there is a problem, and the body parts can vary. It can be the ears, the nose, the eyes. For example, they say maybe my skin is ugly, or my skin is not good enough, or my nose is big. For example, maybe my nose is big. I don't know. Maybe I might be having a body dysmorphic disorder, but I don't think so. I think generally my nose is the way it is. It's big. Anyway, it's not about me today, so let's continue. Another feature is they have some ritualistic behaviors, such as applying makeup all the time, trying to hide the body parts. There are some people you never see without makeup. They can also do mirror checking all the time. Some people also try to avoid mirrors completely. They don't want to see this defect that they perceive is there. And then they also try to seek for reassurance from their family or friends, and they say, oh, my skin is ugly, and then they want you to reassure them that, no, you know what, it's okay, there's nothing wrong. But most times the reassurance actually don't work. It doesn't help them. And most people with the body dysmorphic disorder end up going for expensive visits to the dermatologists and plastic surgeons, and also end up undergoing procedures which are very expensive in a bid that this can solve the problem. But actually surgeries don't solve the problem, and it worsens the problem, because when they do the surgery, all of a sudden they look at another thing as the problem, or another body part, so it cannot be fixed by this. How common is how common is imagined ugliness? The answer is it's about 2.4% of the population have body dysmorphic disorder or imagined ugliness. If that is converted into numbers, and considering we're around 7 billion in the world, it means around 168 million have body dysmorphic disorder, which is a big number. And therefore, it's a serious condition and it's very disabling. So what are the problems that comes with this condition? One is that this condition can lead to isolation, self-isolation, because you feel you're not worthy enough. It can lead to, for example, men, if they think that they're not masculine enough, or if they feel that their genitalia is small or defective, that can lead to being in relationship problems or being single or divorced. And also it can lead to suicidal ideations as well as suicidal attempts, and which is related to depression. Also, this can lead to job problems. They end up not going for interviews, and they just lock themselves. They don't go out, or they only go out at night. The body parts that commonly people perceive to be ugly includes the eyes, the ears, the nose, the skin, the genitalia in men, the body muscles. But how do you know that maybe I'm having a problem or this person is having a problem? You answer yes to any of these questions, you may need to seek help. One is, are you worried about your body image? And do you think so much about this body image and wish that you think less about it? The second part of the question is, how long do you think about this condition per day? Is it more than 1 hour? Do you take thinking about this condition and occupied with this defect? And then the third thing is your main concern how you look? For example, that you're not thin enough or you're worried that you're going to get fat. And then the third question is this affecting your life? For example, is it getting in the way of you interacting with your friends, families, as well as dating? Is it affecting your school or work? Does this feeling stops you from doing certain things? If the answer to this is yes, then probably you may need assistance. Now, the problem with this condition is that most people don't have insight, and they might be very convinced that this defect is actually real, when actually it's not real. Some have insight, partial, or some have full insight that this may not be real, but they are still stressed about it. This condition can be treated by doctors, but when you come to the doctors, they do assessment. They might do some blood tests, which usually is not necessary, but to rule out some conditions. For example, even brain tumors can have this kind of symptoms. It depends on how you present. They might do certain tests, but basically what they do is just, we ask you questions and then check your mood and thought. And then if we come up with the diagnosis of body dysmorphic disorder, then the management is psychotherapy, specifically CBT. CBT is cognitive behavioral therapy, where they use your thinking to modify your behavior, your response to this perception. And along with this therapy, they will give you some medications like antidepressant medications, or medications that are used sometimes for seizures and sleep problems and anxiety, like the benzodiazepines. A common example is Valium or diazepam. The success rate for treatment is quite high, so it's important to get help. So if you find this video useful, please subscribe to my YouTube channel and share as much as possible. This might help somebody somewhere. Thank you very much. See you next time. This is Dr. Ice, the Random Doctor. Thank you very much.